So protecting private practice is something Congress ought to be interested in, but they're going to have to do something pretty quickly, or it isn't going to happen.
Healthcare reform implementation was the primary focus of the ACC's 2010 legislative conference. Nearly 300 members from 48 states and Puerto Rico attended the three-day event in Washington, D.C. to learn more about how major changes in the healthcare landscape will affect cardiology's future, both for the physician and for the patient. ACC CEO Jack Lewin provided an overview of the current state of cardiology based on the results of the college's recent practice census. The data showed CV practices have cut salaries, staff, and services since the 2010 CMS physician payment cuts, which are also causing practices in most states, shown here in blue, to integrate with hospitals.
Every cardiovascular practitioner, whether they are integrated or not integrated, still face many of the same issues. The issues of having our patients have access to the specialty services, to the ability to provide high quality services, to be able to measure the quality of our care, and to be able to learn lifelong about how to practice the best cardiovascular medicine.
It just keeps getting worse and worse. The snowballs, because every time there's no fix for SGR, the payment cuts increase and the reduction in reimbursement increases.
Participants also heard from Donald Berwick, the new head of the Centers for Medicare and Medicaid Services, and discussed trends in the Medicare program affecting cardiology. Berwick has called the ACC an inspiring leader of dedicated professionals working to improve healthcare delivery.
We should hold our patient values first and not our own personal values. And I think as we integrate in practice, as we go to Congress, that with those values that we hold true in terms of being professionals, that we will do the right thing.
Members engaged with the ACC's Political Action Committee. And new this year, the college's Cardiovascular Leadership Institute provided special advocacy training for incoming ACC governors, fellows in training, cardiovascular care associates, and practice administrators.
As we proceed, we can gather more of the tools that we need that might be less traditional, because this is sort of a new can of worms for us.
Leading congressional staff were also on hand to discuss healthcare changes and to foreshadow what they see happening on Capitol Hill. Representative Charlie Gonzalez received the President's Award for his efforts to reverse cardiology payment cuts through a bill he introduced that now includes 125 co-sponsors. He told members they were their own best advocates on Capitol Hill.
Every one of the physicians I go to always takes an opportunity to tell me what the issue is.
The final day of the conference took members to Capitol Hill, where they hoped to relay a message to Congress of lower patient costs and quality evidence-based care.
Representative Gonzalez is putting forward a legislation, and we want them to support the whole thing. And there has to be significant changes in the healthcare reform before it is enacted.
It's not just words, it's actually our patients' ability to come and see us, and it's our ability to employ our staff and take care of those patients that is at jeopardy if they don't address this issue. And the longer they wait, the harder it becomes.
The vast majority of the meetings succeeded in raising awareness among lawmakers and their staff, and making members aware of just how influential they can be.
They seem very receptive. Certainly they understand the need to provide a SGR fix. Everybody agrees that there should be a long-term solution, but nobody knows how to do that.
Hopefully we can continue to push this forward, and it's going to take all of us that have an invested part of the problem to put forward our ideas and work in a collaborative effort with Congress and the Senate in order to accomplish the goals we need to accomplish.
The takeaway is going to be, I think, that these meetings really do a lot more than we think they do. Our coming down here, walking around, has a tremendous impact. I think the only way we could have more impact if we all wore our white coats.
As the conference came to an end, members were confident their messages were heard. The meetings were not only key to fostering lasting relationships, but also in educating Congress about the current state of cardiology as they implement healthcare reform. In Washington, I'm Cherie Black for CBN News.